Good afternoon, and welcome to the NIMHD Transdisciplinary Collaborative Centers for Health Disparities Research on Precision Medicine Technical Assistance webinar. Thank you for joining us. I'm Nishadi Rajapaksa. I'm a program official in the Division of Scientific Programs at National Institute on Minority Health and Health Disparities. In the room with me are Dr. Michael Sayre, Division of Scientific Programs at NIMHD, Dr. Marilyn Lord-Sharp, Acting Chief of Review at NIMHD. In addition, Dr. Reena Das is in the room, capturing and answering your questions via web chat, and our technical guru, Edgar Dews, who is assisting us today. So here's an outline of today's technical assistance webinar. I hope to cover the objectives of the FOA, go over the components of the application and budget information. Dr. Lord-Sharp will then present information regarding the NIH peer review process. There will be an opportunity to answer your questions at the end of the webinar. So please use the chat box to submit your questions at any time during the presentation. We will do our best to get to as many questions as we can within the allocated time. For those who are unable to attend the live presentation, the webinar will be archived at www.nimhd.gov for viewing later. Okay, so let's get started. So just to give you a little background on the NIMHD Transdisciplinary Collaborative Centers, which I will refer to as TCC from now on for Health Disparities Research. NIMHD's TCC program was established in 2012 in an effort to foster collaborations across disciplines and enable multidisciplinary teams of community and academic experts from diverse backgrounds to conduct research in minority health and health disparities. The goal was to develop regional infrastructure for conducting collaborative research, implementation, and dissemination activities that can be implemented in real-world settings to promote health equity. Since 2012, we have established TCCs on health policy, men's health, and social determinants of health. So building on these programs, this RFA encourages research that focuses on precision medicine. President Obama recently unveiled the Precision Medicine Initiative in January of 2015, a bold new enterprise to revolutionize medicine and generate the scientific evidence needed to move the concept of precision medicine into everyday clinical practice. Precision medicine is an emerging approach for disease prevention, early detection, and treatment that takes into individual variability in genes, environment, and lifestyle. For NIMHD, establishing health disparities research centers focused on precision medicine is very important for several reasons. For instance, benefits from medical advances are not always distributed equitably, often because of structural or systemic factors that limit the effectiveness of new diagnostic or therapeutic approaches in disadvantaged populations. While precision medicine holds great promise for improving patient care, its potential for reducing health disparities hinges on a greater understanding of the dynamic interplay between biological, behavioral, social, and environmental health risk and protective factors experienced across the life course. In addition, a great inclusion of health disparity populations in research aimed at developing precision medicine interventions. NIMHD TCCs on precision medicine are expected to stimulate research that will inform therapies across diverse populations. So this funding opportunity announcement invites applications for TCCs for health disparities research focused on precision medicine And the priorities include development of new tools and analytical methods for integrating patient data with information about contextual factors acting at the community or population level to influence health. Development of pharmacogenomic and other precision medicine tools to identify critical biomarkers for disease progression and drug response in diverse populations. Translation of pharmacogenomic discoveries into effective treatment or clinical practice across populations. Finally, investigation of facilitators or barriers to implementing precision medicine approaches in disadvantaged populations. The research is expected to stimulate health disparities research on the interplay between genes, environment, and lifestyle across the life course, great inclusion of health disparities populations in research, develop an integrative approach towards strategies for improving health risk assessments and predicting optimal interventions across populations, greater community input and collaborative community-engaged research, as well as explore new methodologies and approaches in addressing health disparities. So let's talk a little bit about some of the priority research areas. TCCs supported through this initiative are expected to focus on at least one priority research area. Data integration is a top priority for this initiative that includes development of better tools and analytical methods for integrating different types of data obtained from individuals, omic data, clinical data, behavioral survey data, etc. Population differences in pharmaceutical therapy outcomes is another priority area, which includes the understanding correlations with biological and contextual predictors and variability in drug response. This will help identify effective patient-specific treatments that can enhance therapeutic outcomes in patients from health disparity populations. Translating pharmacogenomic discoveries to health disparity populations, the idea is to enhance clinical and translational research to study genomic variations that impact the specificity and drug and response of drugs in patients from diverse ethnic populations. Implementation research is another focus on potential facilitators and barriers of implementation and adoption of precision medicine approaches in health disparity populations. Please refer to the funding announcement for examples of the priority research areas that are of interest to NIMHD, keeping in mind that these examples are not an exhaustive list, but meant to guide you in thinking about the kinds of research that's relevant to this initiative. Please also note that the proposed work must focus on one or more of the health disparities populations that are listed here. So let's talk about the components of the application. So the required components of the application include the overall component, which provides the scientific rationale, how the proposed TCC structure and activities will facilitate productive collaborations, bringing together people with expertise in precision medicine, population health disparities, biological, behavioral, and etc. This includes a multidisciplinary team with the appropriate expertise to conduct the research and center activities. An administrative core to oversee and manage the research, community engagement, mentoring, and career development aspects of program. A research project core with 2 to 3 required research projects, And these projects should be similar in scope as an R01 application. In addition, the required collaborative research projects, each TCC award will support a consortium core and implementation core, and a pilot project program which is optional. Let's discuss the overall component. So as I described earlier, TCCs supported through this initiative are expected to focus on at least one priority research area, and first identify and delineate the roles of the consortium partners. It's also important to think about the scientific rationale for selecting the partners and the populations to be included. Describe the overall composition, objectives, specific aims, and expected outcomes of the proposed TCC. Identify the health disparity populations to be included in the proposed project, and describe topic areas or diseases or conditions of focus. And finally, determine the geographic region to be covered, including the HHS regions where the proposed work will occur. The administrative core will manage and coordinate implementation of proposed TCC activities, including project evaluation, implementation of components according to proposed timelines, coordination of TCC steering committee activities, and submission of annual progress reports. In the application, describe aims to ensure effective management, coordination, and support of the TCC Precision Medicine Research Program and related consortium activities. 2 to 3 research projects are expected to be a part of this application. In the application, state the overall goals of the proposed research project, identify the health disparity populations to be included, and of course the disease or condition under study, and explain how the proposed collaborations will serve to advance scientific knowledge of the interplay between biological, behavioral, social, and environmental risk and protective factors experienced across the life course. So for research projects, it will be a minimum of 2 and a maximum of 3 projects per center. The consortium core will serve as a focal point for organizing and nurturing productive working relationships with consortium partners, maintaining working relationships with community organizations, health disparity populations, and other stakeholders. The consortium core will administer a pilot project program designed to encourage and sustain active participation of consortium partners. Pilot projects may explore emerging research areas, new methodologies, or conduct demonstration projects to test implementation of promising interventions in community settings, or generate preliminary data to support development of independently funded projects. As I mentioned earlier, the pilot project program is optional, and the consortium core may administer the pilot project program designed to encourage and sustain active participation of consortium partners in the full range of TCC activities through sub-awards of limited scope and duration to partner organizations. In the application, describe how the pilot project program to be will be administered by the consortium core. Explain how the program will complement and enhance other TCC research implementation and dissemination activities. Do not propose specific pilot projects in the application. Instead, describe the overall scope and objectives of the pilot project program. Proposed project budgets cannot exceed $50,000 per year for a maximum of 2 years. Recipient-selected pilot projects are subject to NIMHD prior approval. The implementation core will disseminate research findings to collaborators, communities, policymakers, and other stakeholders, develop close collaborations with community partners, health service providers, public health agencies as appropriate. And also, this particular core is expected to adhere to ethical standards that promote values essential to collaborative community-engaged research. In the application, describe collaborations with relevant stakeholders, describe strategies to inform policy and promote diffusion, describe plans to ensure protection of study participants and communities from stigma and unintended harm. To optimize the use of the TCC resources, we encourage a regional focus to the TCCs. Applicants are encouraged to conduct multi-institute projects that may fall within a region indicated or across several regions that are listed here. Of course, I don't expect you to read this slide, but just wanted to make sure you are aware of the correction notice that was issued on June 17th. In addition to the institutions of higher education, nonprofit organizations, for-profit organizations such as small business, government organizations, and other organizations are now eligible to apply. Please check the notice for details about these particular eligible organizations. So I want to spend a little bit of time talking about the funding instrument in terms of the cooperative agreement. The administrative and funding instrument used for this program will be the cooperative agreement U54, in which substantial NIH programmatic involvement during the performance of the activities will occur. Under the cooperative agreement, the NIH purpose program officials and project scientists will work jointly with the award recipients in a partnership role during the performance of the activities. Consistent with this concept, the dominant role and prime responsibility resides with the recipient for the project as a whole, although specific tasks and activities may be shared among the recipients and the NIH. The budget for FY 2016 is $6 million, and we expect to fund approximately 3 centers with an award of $1.5 million in direct costs annually. Here are some key dates to keep in mind. Letters of intent are strongly encouraged because they help NIMHD staff estimate the potential review workload and plan the review. The deadline is August 17th, 2015. The applications are due on September 17th, 2015, and we anticipate for peer review to take place in December. And finally, the council review will take place in February of 2016, with the earliest start date in April of 2016. So now I would like to turn it over to Dr. Lord Sharp to discuss the peer review process for the U50 for precision medicine.
Good afternoon. I would like to give you just a few information on the review process. The link on this slide is a link for training for reviewers. So if you're interested to be reviewers or to understand very well how the review process goes, you can go to that link. So during the peer review, first, the application that you submitted will be assessed for completeness by the Center for Scientific Review. And the NIMHD program staff will assess the application for responsiveness, and which is followed by the NIMHD Scientific Review Officer that will assemble a panel of experts from the extramural community to peer review the application. At least 3 assigned expert reviewers will assess the overall impact of each application based on established criteria. So for the overall, the reviewer evaluates each application potential to succeed. And the overall criteria are significance, investigator, innovation, approach, and environment. The overall impact criteria will be taken into account in the evaluation of all the core and project. So the definition of the overall impact is the overall impact reflects the likelihood for the application to exert a sustained, powerful influence on the research field. The consideration of the score review, the reviewer will consider the score review criteria, but they do not do an average of all of the score because maybe one criteria is more important than another. So it's absolutely not the average of the score. So the other core, some other core will be scored. The administrative core, the consortium core, the implementation core, and the optional technical core. Each of them will receive 1 score. The panel members will review each item that were presented by Nashadi earlier, and so each of them will receive 1 score. For the research project, it's also the 5 criteria that will be used, and each criterion will receive 1 score. So for for the research project, the reviewer will consider each review criterion in the determination of the scientific merit, and so give a separate score for each. It is also important for all the projects, especially, to have the additional review criteria well described. The additional review criteria are included in a determination of the overall score. There is not a separate score, but the reviewer include this description in the overall score. These additional review criteria are the human subject, so the protection of human subject, the inclusion of women, minority, and children, the vertebrate animals, and biohazard. There is also additional review consideration. These criteria are not included in the determination of the overall score. They are still quite important since it's a select agent research, the resource sharing plan, and the budget and period of support. So the peer review meeting, some application may be streamlined, which mean they will have been reviewed by the 3 assigned reviewer, but they will not be discussed. And this is determined by So each application receive a preliminary overall score from the two reviewer. An average is made, and the SRO will determine an average score cutoff point for discussion of the application. During the face-to-face meeting, application with an average score under the cutoff point will be discussed, and the application above the cutoff point will be discussed only if a reviewer requests it. So for the discussed application, the assigned reviewers will summarize their prepared critique, and discussion will be open to the whole panel. The final scoring score will be conducted by private ballot. The final impact score is based on the average of all the voting reviewers, and it's multiplied by 10, 10 being, so the score range from 10 being exceptional and 90 being poor. A summary statement will be available approximately 30 days after the review meeting. And please do not contact the member of the review panel. Thank you. I'm going to pass it on back to Anashadi.
Thanks, Marilyn. So, following the initial peer review, recommended applications will receive a second level of review by the National Advisory Council on Minority Health and Health Disparities. And the final funding decisions will be made based on scientific and technical merit of the proposed project as determined by scientific peer review, availability of funds, or relevance of the proposed project to program priorities, and the geographic distribution of award recipients. So at this time, we would like to entertain some questions that we have received through the chat box. Also, you have an opportunity to submit any questions at this time. We have about 20 to 30 minutes to talk about or answer any questions that you may have. Okay, so we have, let's see. So we have received, so here are some questions that we've received. Question number one, what is considered a regional partnership? So each application is expected to form partnerships with multiple institutions and organizations within or across regions that were listed in the RFA. All of the research activities should not be conducted in one institution. And then there's a question number two. What is the expectation for a transdisciplinary project? Each research project is expected to include multiple disciplines, such as the study of genomics, along with environmental, social, or behavioral factors for a particular health disparity condition. And these projects should be in the form of similar to an R01 application with preliminary data to support the aims. Okay, so the next question is, what are the sections in the application that need to be included for the overall component? In the overall component, the applicant will describe the TCC activities under significant innovation approach categories in the 12-page limit. As there are categories, it will be evaluated on. Okay, so the next question. Should the applicant include details on the pilot projects? no, do not provide specific details on the pilots. Instead, describe the pilot project program in a broader sense. And keeping in mind that the pilot projects would be submitted to a NIMHD prior approval at a later point. Okay. Are there any more questions?
Yeah.
Okay.
So I'm going to turn it over to Dr. Michael Sayre. I think he's going to answer some additional questions that we have received at this time.
All right, thank you. So another question is regarding pilot projects is how many pilot studies can be supported in each year of the award? So in the RFA, we say that we expect the pilot projects to commence in the second year. So you could have 2 pilot projects in the second year, and each project could be 2 years in duration. In the following year, you could add an additional 2 projects. So in the second year, the expectation is that you would have at most 2, and then in the subsequent years, you could have up to 4, because projects will be rolling off as new ones are coming on. Next one. Oh, there is I think in one of the slides that showed the page limits for the different components. There's an error there. The administrative core page limit is 12 for the research strategy.
Okay.
And that part of the reason that that's longer is that we expect the applicant to include an evaluation plan in the administrative core. So I apologize for the error. That is 12 pages for the administrative core. Can the collaboration be between 2 or more different regions? And absolutely yes. If you look at TCCs that we support now, you can get information about them on the NIH reporter. There are some that actually have a national reach. So yes, you can collaborate across regions. It's important to note that it's up to the applicant to define the region that they're going to be working in. So we're not requiring that it be a particular size, but we do want you to just delineate the region, get the rationale for conducting research and other activities in that region, and specify which of the HHS regions the work will occur in. How does NIMHD view multiple PIs from different institutions or the TCCs? We think that's fine. We want the TCCs to be managed in the most effective way possible. So if that means that a multiple PI mechanism involving multiple institutions is the best way to get the work done, then that's what you ought to propose. How many years is this grant? The project period for these awards is 5 years. Whether they will be renewable will depend on NIMHD's operational planning process for I guess it would be FY 2021.
Yeah.
So it's impossible to say at this point. Our intention is to sustain the TCC program, but of course we can't. We don't have a crystal ball that can tell us definitively whether these will be renewable. Will proposals that apply to health policy be considered? Yes, as long as there's a clear focus on precision medicine and how health policy plays into that. So, for example, in the implementation research priority area, let's see if I can find it here. Implementation research, some examples include acceptability among health services providers and systems that serve health disparity populations, including but not limited to issues surrounding access, cost, and reimbursement for clinical services. So these are all health policy topics. An institution is limited to one application, correct? Yes, that is correct. If institution A is the prime applicant for a center and institution B is a subcontract on the grant, is institution B precluded from applying for submitting as a prime, precluded from applying as the prime on a different application? No. There's only one application per institution, but the RFA does not put any limit on the number of applications an institution can be involved in as a partner, a consortium partner, or a sub-award. You mentioned that all research must not be conducted in one institution only. Does that mean that each project needs to be conducted across all the institutions? No. If you structure the projects in the way that makes sense based on the science, the research questions that you're trying to answer. Can one project be conducted at one partner institution while another one is conducted at a second or third institution? Yes. There's nothing in the RFA that says you can't do that. Again, it has to make sense scientifically, and we do expect the projects to be complementary to one another. So we're not looking for applications where we have 3 projects that are on completely different topics that have no synergy. Can a center focus on several diseases that have similar risk factors? Yes. If your institution has a TCC, would they qualify to lead this TCC, or would it be better to partner with another institution? Well, again, the selective factors when we're making funding decisions are going to, scientific and technical merit is going to be a real big factor for us. But we do have geographic distribution as one of the funding considerations. So I can't provide a definitive answer for this question. It just really depends on the circumstances, what we're presented with after the peer review is over. So if you think, if you're at an institution that has a TCC and you think it would make sense for you to partner with another institution that doesn't have a TCC and have that one be the prime, then you may want to go that route. But we're going to take into account all the different factors, and the balance will be determined when we see what we have to work with. Please go over the rationale for having the work defined regions. Well, the research, what we're trying to do here is have research that addresses health disparities at the population level. Now, I know at precision medicine, everyone thinks it's all about the person, but in health disparities, we know that many other factors besides individual biological factors impact health, and the person is placed in the context of, the community, there's socioeconomic status, all these community ecological factors. So we're interested in supporting research that will have an impact on populations, not just on individuals. So populations occupy regions. So that's why we have the regional focus. We're trying to have a broader reach than can be achieved with research projects focused at a single a site or a neighborhood or a single health service provider. We're looking for a broader reach. What is expected in terms of demonstrating substantial community stakeholder involvement? Well, In the instructions in the RFA for the overall component, we talk about letters, memorandum of understanding with the consortium partners. And so the expectation is that there will be a letter or a memorandum of agreement or understanding for each proposed consortium partner organization, signed by an authorized official of that organization, and that's important that there be a signature, describing that organization's expectations for the partnership and its roles and responsibilities on the project. So we expect the consortium partner organizations to have active, substantive, and important roles in conducting the research as well as any of the implementation and dissemination activities. The rationale for emphasizing these partnerships, and again, TCCs are regional coalitions of research organizations and community-based organizations, health service providers, public health, state and local public health agencies, everyone who has an interest in tackling and eliminating health disparities. And the rationale for that is that these partners are going to be critical for translating research advances into real-world applications that actually make change happen on the ground. Please comment on inclusion of foreign components as comparison populations in studies looking at race and ancestral backgrounds. Is this encouraged or discouraged? Foreign components are allowed, and if it makes sense scientifically to have a comparison population, then you can propose that. We're not encouraging it or discouraging it. Whatever makes sense scientifically. How will indirect costs be dispersed across multiple institutions where the research takes place? At the end of our slide set, we have contact information, and that is a question that has to be directed to our Chief Grants Management Officer, Priscilla Grant, because that is beyond my expertise. Can a study, for example, a clinical trial, be conducted at multiple centers within the consortium? Yes. Is there a minimum required in terms of the number of institutions involved? In other words, does that be a minimum number of institutions? No. Well, there has to be more than one. We'll put it that way. Okay, this question refers to subawards. Oh, it's another one. How will indirect costs be distributed? Again, that is a grants management question, and unfortunately, we don't have our grants management colleagues here to answer that, but they would be very happy to answer any questions you have regarding financial matters. And their contact information that's displayed on the screen here is also in the RFA. Wait, okay, is that it? That's the only questions we have?
Wait.
There was one more question I thought I saw. Oh, someone asked, is a life course approach required? Does a project required to have a life course approach? Life course approach is in health disparities research in general is encouraged. It's not required. It depends on the specific project. It depends on the science. The approach that you propose should be appropriate for the research questions that you're posing. So, for example, a particular project, so let's say you're going to propose 3 projects, and a particular project could focus on a specific age group, but then you might have complementary projects that focus on different age groups looking at the same research question. But again, it just depends on which priority research area you're addressing and what are the research questions you're asking. And yeah, so a life course approach could be most appropriate for prospective or longitudinal studies. Considering this is a transdisciplinary award, to what extent should each discipline be represented? For example, should there be a basic science, clinical, social science, CBPR, etc.? That's a good question. We expect that each project will be led by a team of investigators that includes expertise in precision medicine, and that could be basic biological sciences, genomics, metabolomics, microbiome, as well as population health disparities expertise, because again, we're trying to integrate the individual with the population and integrate information about the individual with information about the population to better understand the interplay between the individual and the community and the environment and social factors, as well as expertise in science of implementation and dissemination, because that is a major focus of the TCC program. What is the balance between discovery versus implementation that is optimal? Well, that's going to depend on the topic area and the research questions that you're asking. So there could be, we expect that the applications will really span the spectrum in terms of that balance.
Right. And they can always contact, you can contact me. This is Nishadi, in terms of discussing any of the scientific aspects of the application or aims.
Okay, so there's another question. Since no foreign countries are listed, health disparities internationally are thus not applicable, correct? This relates to a previous question. Foreign components are allowed. Foreign applications from foreign organizations are not allowed, but foreign components are allowed. So you could have, for example, in the previous question, you could have a reference population at a foreign site, and you could be doing comparisons between that population and the domestic population that's being included in the study. This is not. The focus of this RFA is health disparities research in the U.S., so it's not a global research program. Hold on. Okay, given the funds allocated, does NIH expect the omic approach to leverage existing omic data or build this prospectively? Well, I think within the confines of the budget, it's more realistic to talk about leveraging existing omics data, but there could be, some additional data collection, feasibility studies looking at combining omics data from different cohorts, existing omics data from different cohorts. This is a review. I think this is a review question. Having a TCC already in an institution, will that be considered a plus, or will it be a negative for the applicants? So in other words, if an institution that has a TCC submits an application, will that be a plus or a minus?
I suppose the reviewer will maybe see that you're able to have a good partnership, if it's described in the application, because so the reviewers are going to look at that. But I do not know what is the value of a programmatic question, or so I cannot really say. It just if your TCC works very well, they can see at least on that side that you have good relation with your partners and that everything is in place, the leadership and the good management of the application.
What is meant by studying the feasibility of pooling and augmenting existing data sets? Do we have to actually show the integration across existing data sets or just show the feasibility of doing it?
Right. I think it's more than just showing the feasibility of integrating all the different data sets. I would advise that you conduct some research on the integrated cohort or the data that you find. So it should not be just limited to the fact that you're able to integrate the data, but it should be more than that. Certainly.
All right. Are the priority research areas ranked according to their priority standing with NIMHD in the RFA? No. No, these are all equally important. You've seen those. Okay, will a TCC that only focuses on data integration be compliant with the RFA? Yes. You have to pick at least one. You don't have to pick more than one. Will it be required to show integration of variations in biomarkers and their interactions with relevant contextual predictors in clinical research cohorts and patient registries involving multiple chronic diseases across regions and institutions? Well, that is certainly what we're encouraging in the RFA. So the reviewers are going to be looking at that.
Right.
Will a copy of the slide set be made available? Yes.
Yes.
And we will also post answers to the questions that we've received
on our
website, where the slides will be deposited as well. Is there any emphasis on disease, such as cancer, diabetes, etc.? No. We're a disease agnostic here at NIMHD. We are very interested in multiple conditions, comorbid conditions. So they can involve a variety of different diseases. But there is no particular disease that we're or condition that we're targeting with this RFA. In the RFA, wait a minute, where'd it go? In the RFA, it says that this program is not intended to support activities targeting a single neighborhood, municipal jurisdiction. Can you elaborate? Well, again, this gets back to the regional approach for the TCC program. We're looking for regional collaborations that involve a broad cross-section of organizations that are interested in understanding the causes of health disparities and then doing something about eliminating health disparities. And oftentimes that involves service provider systems, public health agencies, education departments, so people actually, and policymakers as well. So. Does the PI of this RFA have to be an expert in precision medicine? No. But the research team has to include expertise in precision medicine and as well as population health disparities and implementation and dissemination science. There are no more questions coming. I think we've gotten all the questions. We've answered all the questions that we have. So how many minutes do we have left, Edgar?
5 more minutes.
We have 5 minutes left. So if anybody has any additional questions, please submit them now. And no. What's this? Nope. No more questions. No. You got one? We got another question coming in. Oh, it's a comment. It's a good comment. I would like to make one point, emphasize a point about applications are expected to demonstrate substantive community input into the identification of research questions to be addressed by the proposed TCC and the relevant contextual predictors that will be examined in conjunction with the biological predictors. And for the purpose of this RFA, community in this sense refers to a group or population that may be defined by geography, race, ethnicity, culture, gender, disease or other health condition, or a common health-related interest or concern. And one of the reasons for emphasizing this is that there's research that's shown that diverse teams working together to capitalize on innovative ideas and distinct perspectives outperform homogeneous teams, and involving community stakeholders in needs assessment, project planning and design, implementation and dissemination of results enhances their participation in research and facilitates development of workable interventions. And again, one of the priorities of this RFA is to increase the participation of health disparities populations in research around precision medicine because we don't want them to be left behind. All right, I think we've run up against the time limit. So we will, any questions that we haven't been able to answer, we will post answers on our website. And again, feel free, probably with 3 to 4 weeks.
Yeah.
Contact anytime the folks listed on the screen, NIMHD Rajapaksa for the scientific and research questions, Marilyn Lodge-Sharp for peer review questions, and Priscilla Grant for financial and grants management questions. So thank you all for participating in this technical assistance webinar. I'll turn it back over to NIMHD.
Yes, so thank you again for joining us today, and so this concludes the webinar at this time. Thank you.